So this was a 67 years old patient stethoscope PTCA to RCA 10 years back and now presented with the CAD SCS and STEMI. So you can see this RCA shot. There is a right from the proximal RCA, there is a stent up to the mid RCA, and this is a type 3 ISR in-stent restenosis. You can see the lesion after the stent also. The stent is up to mid RCA. So there was a long stent right from the ostium to the mid RCA. So we decided to put a stent. So this was a right radial root approach. We took a BMW PTCA wire and we crossed the wire in the lesion. So as it was a long stent were there earlier, so we thought of putting a small two stent. One is in the distal part of mid RCA and then second is the proximal mid part of RCA. So this was the first stent. As it was a long stent was there in the proximal RCA. So this was a stent deployment in the distal part of mid RCA. And this was a second stent. So in the proximal part of mid RCA. So we overlapped this middle stent with upper stent and lower stent. This was and the stent we deployed here. The stent was 2.75, both stent was 2.7524. And this is a picture after the stent deployment and overlapped. We overlapped both stent. In second stent, in proximal stent, you can see some sort of haziness. So we did the NC over there. And this was the picture, and then we overlapped stent. And this is the cine after. There's a TIMI 3 flow. So this was an angioplasty to RCA with in-stent restenosis type 3 and in mid RCA in this end-STEMI patient.